Families need to focus on this.
So joining us to talk about heart health is Dr. Dawn Huey with UT Health San Antonio. Good morning, doctor. Thank you so much for making time for us this morning.
Good morning. Thank you so much for having me.
So just to set a foundation, what exactly is heart disease and who does it affect?
That's a great question. Heart disease is, well, the first thing to know about heart disease is that it is the number one reason that people die, both for men and women in the United States and in many parts of the world. Heart disease is just a very broad term, but it means several conditions that affect how well the heart functions and how well the heart is healthy.
Now, in terms of who it affects, it doesn't discriminate age or where you're from, right?
Correct. Age is one of the risk factors, but other important risk factors include diabetes, high cholesterol, smoking, and obesity.
When you say smoking, does that include vaping as well?
Vaping is pretty new and we're still learning quite a bit about its effects, so I think that remains to be determined.
In terms of warning signs, what should people look out for?
Okay. Well, I think most people recognize that, the well-described crushing or very severe chest pain in the left chest is a very clear warning sign. And most people know that if that happens, you should call 911 and get to the hospital. But there are some more subtle signs, which actually I think are more common in the population nowadays. Another way that heart disease presents is that people think it's heartburn, but that heartburn doesn't go away with heartburn medication. So that is a very common sign of heart disease. More chronic heart failure signs include swelling in the legs, feeling shortness of breath or fatigue when you're doing your usual activity. Women and people with diabetes also present with less common, what we call atypical signs, and those would be pain in other locations such as the back or the abdomen rather than the chest. Pain in the neck or the jaw is also a sign of heart disease.
Okay, let's talk about prevention. So at what age should people be going to their doctor and asking for what tests to be done?
Okay, that depends a little bit on your personal risk factors as well as family history. So if you have a family history of people having heart disease at a very young age, then you should go and seek care from a consultation from a primary care doctor to talk about it. And I would recommend generally if, at 5 to 10 years younger than the person in your family who had the presentation of their heart disease. Otherwise, I think if you don't have risk factors such as diabetes, smoking, obesity, generally seeking consultation with your primary care doctor at about the age of 40. But, especially in Bexar County, very many people have diabetes. That's an extremely strong risk factor. So certainly if you have diabetes, talking to your doctor about screening for heart disease would be important.
We talked about risk factors. How prevalent is heart disease here in San Antonio?
It's unfortunately very common, and we see it commonly in young people. And again, that's because of a very high prevalence of diabetes in this area. There's a very strong family history component that we see as well in this area.
So as a physician, what does someone's daily lifestyle choices affect their heart?
This is the hard part because it's all the little decisions you make during the day. And that doesn't mean that you have to live a completely joyless life. As we say, everything in moderation. So only the things that, really should be completely cut out are smoking and heavy alcohol use. Alcohol in moderation is okay. And there are some studies suggesting that alcohol that includes red wine may be favorable. But other important aspects of heart health care and daily living include exercise, or at least activity that gets you up and moving around. Exercise doesn't have to mean going to the gym or running 5 miles. It can include things that are fun, such as hiking, running around with children or grandchildren, just anything that gets your heart rate up. The recommendation is to have 150 minutes a week, so that would be about 30 minutes over 5 days of moderate to intense activity. Heart healthy diet is very important. Again, things in moderation. It's okay to eat red meat and occasionally fried food, but in general you want to try to avoid those. Focus on vegetables, fruits, and lean meats.
All right, doctor, thank you so much for starting your morning with us. We really appreciate it. Anyone who has any questions or wants to watch the interview in its entirety, we're going to have that on ksat.com throughout the day. Time now, 8:11, 35 degrees out.
Well, the Federal Drug Administration, they are considering easing up on blood restrictions for the LGBTQ plus community. What this means for our local blood donations.
And speaking of local, taking a live look out at the Alamo City, a crisp start to your